My name is Chad Armstrong. I'm founder and CEO of Evinance, a Montreal-based software company focused on reducing costs and improving patient outcomes by providing clinicians with the most credible evidence-based decision support in real time. So some of you may know one of the biggest problems in healthcare today is inconsistent decision-making by physicians. But it's easy to understand why this happens. There's a ton of new evidence that's constantly entering the market, new devices, new drugs, from the New England Journal of Medicine and the FDA. The options available to physicians is constantly changing and increasing, essentially making it impossible for them to keep up with the latest trends. Now, there are organizations in the marketplace today who try to assist them by going through all of this evidence, and they put together what's called clinical guidelines. Basically, it sets up rules on which treatment should be provided to patients based on their condition. Today, they're building these guidelines using tools like Microsoft Word, so the end result is pages and pages of unstructured, narrative-based text. So when a physician's meeting with his patient and he needs to look at the guidelines in order to see what the latest evidence says he should be doing, he's got to go hunting for the information. He needs to click through lots of pages, search through lots of documents in order to find the right information for his patient. And basically, this process is very tedious, it's very time-consuming, and what the result is that most of the time they won't even bother going to look at the guidelines. And this leads to billions of dollars in waste. You have $210 billion in unnecessary services provided annually, $130 billion in inefficiently delivered services, and $55 billion in missed opportunities for disease prevention. So our solution to this is to stop forcing the physicians to go look for the information they need, and instead put it at their fingertips right when they need it. And we do this by providing a platform that allows those expert organizations to build structured guidelines. And so what we mean by structured is that it's input in such a manner that we can now exchange this information with other systems. So when a physician's with his patient today, and most of them are working within electronic health record systems, which means that they're accessing the patient file electronically. So when they pull up the file now, what happens behind the scenes is that that system can pass us the patient record. We can analyze that against all of the guidelines for that specific provider, and then return back the patient-specific set of recommendations. So he sees this in the EHR in real time when he pulls up the patient's file. So this dramatically reduces the amount of time that he needs to make the right decision for his patient, and ultimately allows him to treat more patients in a given day. So where did we come up with this? Well, we've been working over the last 5 years with the National Comprehensive Cancer Network, which is an alliance of 21 of the world's leading cancer institutes. They're the global leader in oncology, and their guidelines are essentially referred to the Bible in cancer care. So with them, we've built a secure, scalable, cloud-based platform that allows guideline developers in different locations to work collaboratively to build all of these expert guidelines. And we've had interoperability in mind since the get-go, so it aligns with all the latest HL7 standards and all the latest coding vocabularies. And of course, we wanted to make sure that it holds up to real-world constraints, so we've also been collaborating with the largest oncology EHR vendor in Electrum Mosaic. What you see up here is the two main users of the system. On the left, you see the guideline developers. So we're only going to charge them a nominal fee to use the system because we want to encourage them to get on the platform and build as many expert guidelines as possible. So we make our money by charging an annual software subscription fee to the providers over on the right. So this gives them access to the big repository of expert guidelines. They can go in, they can adapt them to meet their local conditions, and then basically as soon as they save, those guidelines are available in real time to the EHR system. This is the team behind Evinance. I myself have over 12 years experience in product management and consulting, and was the one who led the team that developed the guideline platform with the NCCN. Mayor Levy is the founder and CEO of Interfacing, which was the company from which Evinance was spun off, so he plays a very strategic role at Evinance. Albert Fazeli is the technical brains behind the platform. And finally, Donald Simborg, who's our active board member and very well known in the healthcare informatics space. He plays a very crucial role at our company. He's actually been the founder and CEO of 2 former EHR companies, both of which he sold, so he's been instrumental. So with that, I'd like to thank you very much, and hopefully you're as excited about the future at Evinance as I am.